Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmon talks to Dr. Jennifer Gerber, who recently earned her PhD in International Health at the Johns Hopkins Bloomberg School of Public Health. They talk about the importance of the flu vaccine this fall, given the need to keep people from getting sick and filling hospital beds that may be necessary to hold for people with COVID-19. Let's listen.
Jennifer Gerber, thank you so much for joining me.
Thanks for having me, Stephanie.
So today we're going to talk about the flu vaccine, which is not something we've been thinking about lately. We've been talking a lot more about a vaccine for COVID. But why should we start thinking about this?
We're expecting to have an increase in COVID cases this fall and winter at the same time that influenza occurs annually. And so it's important that we increase the proportion of the population that's vaccinated against influenza as a means to protect ourselves and our communities, but also to help save hospital capacity to treat those with COVID-19. Because influenza can progress into pneumonia and require hospitalization and can lead to death. And so we want to be able to reserve the ventilators and respirators and hospital workers' attention for those with COVID-19, since that isn't yet vaccine preventable.
My next door neighbor is an infectious diseases doctor, and he says he is fearful of what's going to happen when flu season returns, that there'll be a lot of people who think they have the flu, who might have COVID, who think they have COVID, but they have the flu. What kind of situation do you foresee?
I think that's a reasonable concern. Some of the symptoms for COVID, like loss of taste and smell, are very different than for influenza, although it's only a small proportion of cases that have those symptoms. So I think if you are ill this coming fall and winter, it's important to contact your primary care provider or an urgent care clinic or another setting to help determine whether or not you need a flu or a COVID-19 test.
The symptoms in the end, though, can be very different.
That's true.
And COVID is a much more dangerous sickness.
Well, right now we have much higher fatality rates from COVID compared to influenza. And part of that is that we don't yet have effective vaccines for COVID, and we don't have any licensed drugs. There are some that are being studied under emergency use authorization. They're not yet available to the broader public. The difference with influenza is that we do have other drugs like Tamiflu, which are licensed for widespread use. So if you contact your physician and they determine that you have influenza-like illness, so you have influenza symptoms, they may order an influenza test, and then they can prescribe Tamiflu. But it only really works if you start it within the first 3 days of symptom onset. So it's important that people contact their medical provider right away.
And it only works on the flu, not on COVID.
Yes, it only works for the flu.
So back to the flu vaccine. Why don't a lot of people get the vaccine? I see that 63% of kids and 45% of adults get vaccinated. That seems pretty low.
Right. So there are several reasons for this in terms of not enough demand for the vaccines and not enough access to the vaccines. So there are several vaccines that are recommended or required for children to attend school in all of the states. But influenza is actually not required for kindergarten through 12th grade attendance by any state. Those 6 states require it for children to attend daycare. So when parents see that influenza vaccines aren't required, they sometimes misperceive this as influenza vaccines are not necessary or important. And some people think that influenza isn't a serious disease that warrants vaccination. So they think that they've had influenza when in fact they may not have actually been tested for influenza. And they may have had another respiratory virus like those that cause the common cold. Influenza is a specific virus that causes a respiratory disease, and it can lead to very serious illness. Other reasons that influenza vaccines are underused are that people misperceive influenza vaccines as being dangerous. So some people think that you can actually get influenza from the influenza vaccine, and this isn't true. The influenza vaccine contains pieces of killed or attenuated virus particles, and so it's impossible to get influenza from the vaccine. However, people often experience headaches, sore arms, fevers, or other flu-like symptoms after they get vaccinated. And this is actually a sign that your body is appropriately responding to the vaccine. So your body is having an antibody response and preparing to fight the infection. So if you are later exposed to influenza weeks later, then your body's prepared to fight that infection. And it's also important to know that influenza vaccines don't work for approximately 2 weeks. So it takes them about 2 weeks to work until your body is ready to fight the infection after you get vaccinated. So it's possible to get exposed to influenza within that time period, and the vaccine hasn't had time to work properly yet.
How can we boost the numbers of people getting the flu vaccine? Because it sounds to me like we really should be doing that given what we see coming down the road with COVID.
Absolutely. So we need targeted communications campaigns to different segments of the population to address these misperceptions about influenza vaccines. And these campaigns should also be targeted to different age groups, such as to educate the elderly that there are options for high dose or high titer vaccines that work better for those populations. And we also need to increase access to these vaccines, making them available at schools, in pharmacies, and other central locations at low or minimal cost. One of the things Dan Solomon, the head of the Institute for Vaccine Safety at Johns Hopkins, and I have been talking about is the need for advanced purchase commitments. And so this is a mechanism the federal government can use to go to pharmaceutical companies that manufacture the flu vaccine or influenza vaccine and get them to agree to buy a certain number of doses from those companies as a way to encourage those companies to increase production without them fearing that they might lose money if people actually don't buy the vaccines. And so these kinds of mechanisms have been used by Gavi to secure vaccine supplies for low and middle income countries, and they've been used by the United States federal government during the H1N1 outbreak.
I, for one, usually get my vaccine when I'm at work. I'm sure a lot of people do as well, but I'm working at home and a lot of people are working at home. And so I'm wondering, are we going to have access problems if we're working from home?
Yes, that's definitely a concern of mine as well. You've probably gone to the Johns Hopkins clinics as I have, which is a very easy way to go across the street and get your vaccine in about 10 minutes. Hopefully, our employers can partner with pharmacies to make getting the vaccine easier for those of us working at home.
When should we start getting vaccinated?
So influenza occurs annually each fall and winter. And so it's important to get vaccinated early in the influenza season. As I said, it takes about 2 weeks for the vaccine to start working. And so late September, early October would be the ideal time.
I know that minority communities have been hardest hit by COVID, and I think they're less likely to be vaccinated against the flu. And so I'm wondering how we should be trying to reach these communities with a campaign about flu vaccine.
Yes, I was reading an article today about how COVID has been devastating Latino communities in Oregon. And so it's definitely a concern of mine that these communities are really struggling to fight COVID and that they could also be struggling with influenza in a few months. These minority communities are generally less likely to accept flu vaccination compared to white populations. And so we need culturally appropriate communications and to identify leaders in those communities who can be champions for these vaccines. We know that in the last year, approximately a third of those who were hospitalized with influenza were aged 18 to 64. So many of them were probably working adults and missed income from their jobs while they were hospitalized if they didn't have paid time off. And we know that there can be a lot of costs associated with hospitalization and recovery. And so I'm really concerned about these communities and want to make sure that individuals understand that the flu vaccine is something that can be used to protect themselves and those in their households.
Now, I know that we've discussed that uptake of the flu vaccine is not as high as for other vaccine-preventable illnesses. I also know that it's actually not quite as effective as other vaccines. I know that I always religiously get the flu vaccine. This year, I happened to get the flu B. And I was sick, I was very sick, but only for 5 days. What do we tell people who say, well, I've had it before and I got the flu anyway, so why should I do it again? By the way, for the record, I will be getting it again.
Well, I'm happy to hear that. That is an unfortunate truth, is that there are many different influenza viruses, and the vaccines we get in the United States tend to protect us against 3 or 4 different kinds of the virus. But this virus mutates really quickly. And so there isn't always a perfect match between the vaccine and those viruses circulating in our community. But the good news is that even though you got sick after getting the flu vaccine, odds are that you got less sick and less severely ill and had a shorter duration of illness because you got that flu vaccine. Flu vaccines are very good at reducing the chances of having a very severe illness and having a bad outcome requiring hospitalization or potentially leading to death.
Well, I really hope that your work can convince people to go out and get their flu vaccines this year. It sounds to me as though it's more important than ever.
Yes, I think it's incredibly important that everyone get the flu vaccine. And if I could make one more point, it's that there was a really important study that came out of Japan recently that showed that when they vaccinated school-aged children, this had a really huge impact on reducing illness and mortality among the elderly and reducing illnesses in their family, including for their younger siblings. So flu vaccines are recommended for those 6 months old and older. And so those infants can't be protected against flu vaccines, except for if their mothers get vaccinated while they're pregnant and their other household members get vaccinated. It's a way of cocooning and protecting the infant. And today I heard that there are 50 newborns at a hospital in Texas infected with COVID. And so this shows that the importance of having these antibodies and protection from those around you, because there's very little we can do right now about COVID, but we can do something to prevent influenza.
Jennifer Gerber, thank you so much for joining me.
Thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.